And I started using
I'm Dr. Thomas Branch, CEO and founder of Ermi. As an orthopedic surgeon, I know that motion loss is the #1 complication in orthopedics. It is our mission to help all patients with motion loss secondary to joint stiffness. We hear your voices.
Got knee replacement surgery 3 years ago, and then I had a revision done to my kneecap, so they had to pull my kneecap and replace it. Which, after the surgery, starting the therapy process, we got hooked up with the flexionator, and at that time I could barely bend the knee at maybe 70 degrees. And within 4 weeks, I was able to get 130 degrees, which was my full stretch, and I was blame it 100% on the flexionator, because if it was only with the physical therapy, I couldn't really pull my leg back with my muscles that far.
Yeah, I had my total knee replacement done, and I had home therapy. I had outside therapy, but once I got to the knee inflection machine, I was able to get it all the way up to about 130 degrees.
So we'll start with your external rotation, how far you were able to get.
When I started, I was here.
And where are you able to get now?
Up here.
Wonderful. Is that painful?
No.
Good. And next one for your abduction, how you were able to actively abduct your arm before getting the device.
I was about here.
And where you're at now? Wonderful. You can relax it. Next one we'll do is going to be the forward flexion, how you were able to get before getting the device.
I was about here.
And now where you're at? Tremendous. Last one, if you wouldn't mind.
Najee Butler. I've been using the ankle flexionator for about 5 months now. I feel completely different than when I started. I have more range of motion. I'm able to golf again, so that's my career. I'm a golfer, so it's really important that I'm able to be on my feet. So I want to say thank you to Ermi for allowing me to have an increase in range of motion and flexibility.
I've been using the device, and I can now reach behind my head to shave the back of my head. I couldn't do that before. I can reach around back to run my belt through the belt loops. I can raise my arm straight out or to the side without pain, and I sleep considerably better than I used to. So it's helped me a great deal.
My name's Dave Kucharik. I've been using the machine, and I could able to go up this high, where when I first started I was like here. So again, up here when I first started was here.
My name is Darcy, and I had this device for about a month, and before I started, my range of motion was pretty low, and now it is pretty high. It allows you to have the stretch that you get at PT without actually having to go to PT every day, and I find it very useful.
Morning, noon, and night.
Okay.
Which it began to loosen my knee up more and more, because I never sat down once I had the surgery. I was always moving.
Good for you.
But the Ermi chair, I started using it at home and hold it for 10 minutes and release.
Okay.
And it's been tremendous. So by the time I went and saw Dr. Kim in October, he said I'm no longer needed.
Had an accident which caused me to break my tibia plateau last year in December. It's been about 6 months now. When I first started using the Ermi machine, I was bending, or I was pretty much stuck at around 70 to 73 degrees. Since using Ermi, I have managed to get to 105 degrees, which has been incredible. I'm so thankful for this machine and for this assistance. You know, my life has definitely become a lot more manageable. Mobility is getting better and better, so I definitely recommend Ermi.
Using this machine, great machine. I had no range of motion when I started. Now I get full range of motion after about 6 to 7 weeks.
My name is Wade Chu. I'm a 100% disabled American veteran, permanent and total. I was viciously attacked
by people, by my neighbors. And this is how Cordell found me when he first delivered the Flexinator, or as I like to call it, the knee crusher. Well, I've been crushing my knees according to your directions, and look at what I'm able to do today. Okay? Look at that. Look at that. Okay, so thank you for having a working relationship with the Veterans Administration. This would not have been possible without this wonderful machine. And there are a lot of gimmicks in the insurance and medical industry. This is not one of them. Okay? So if you're a clinic, a clinician, please get your patient this, because they don't have to visit you as often.